Welcome to the Natural News Talk Hour. I'm your host, Jonathan Landsman. Our show today, IV vitamin C, cancer therapy, plus much more. Our guest is the Chief Medical Officer of the Olive W. Garvey Center for Healing Arts, the clinical division of the Riordan Clinic. A 1976 graduate of the University of Kansas School of Medicine, he has devoted his career to the emerging paradigm of self-care, the patient as an informed medical partner. From the first days of medical school, he has sought to find new ways of encouraging his patients to take better care of themselves, form new and sustainable habits of health, and to assume greater responsibility in their own health care. Named the 2011 Orthomolecular Doctor of the Year by the International Society of Orthomolecular Medicine and a 2013 inductee into the Orthomolecular Hall of Fame, please join me in welcoming Dr. Ronald Hunninghake to our show. Dr. Hunninghake, welcome.
Wow, thank you very much, Jonathan. That even sounds bigger than what I had recalled.
This show is for educational purposes only. Always consult a trusted healthcare provider for medical issues that concern you and make an informed decision. For more information about Dr. Hunninghake and the Riordan Clinic, please visit riordanclinic.org. Dr. Hunninghake, I think this would be most interesting, especially when I interview conventionally trained medical doctors. What made the switch for you as we start off this program and got you so interested in vitamin C? Obviously, you don't learn this in medical school.
Well, even when I was in medical school, I remember asking the question, when are we going to talk about health? Because medical school is about disease. And the emerging paradigm that I see sweeping the world, actually, is the shifting of our attention from what we don't want, which is disease, obviously, to what we do want, which is better health. And that simple idea has been the cutting edge for what I've been doing for the last 25 years, which is looking into ways that human beings can improve themselves using natural products, using better lifestyle choices, but most importantly, assuming responsibility for their own self-care and learning how to be a more complete, full potential human being. And so all of these things are involved in the holistic care of people who have been chronically ill. And so that has been my purpose in the last 25 years at the Reardon Clinic.
Yeah, I just wanted to make a quick observation before we get into how vitamin C can actually help injured and sick people. But don't you find it interesting that it does seem to be inbred into Western culture, this sick mentality, if you will, of just saying, gee, I hope I don't get cancer. No, I really don't want to get sick. And everybody's focused on being afraid of all these illnesses when so many people are still not busy talking, around the coffee machine or the water cooler or around the house about, what did you do today to really feel good? It seems like a corny thing to say, but it seems like that is something, like you say, that we need to shift towards all the time, everywhere throughout the Western world.
Robert Fritz is one of my favorite authors, and he says that he thinks a big shift is going on in what he calls life stance. And we're shifting from the reactive life stance, where we're trying to avoid what we don't want, to the creative life stance, where we're going to use the resources that the world has in order to create that which we want. And whether that's happiness, good health, great energy, wealth. Wealth is not just money. Wealth is all those things and living a good life. So it's really inherent. You could even go back to Greek philosophy. This is not something new. I think it's a rebirth of the idea that we are responsible for the lives that we create.
So let's get right to it. How does vitamin C, in your opinion, help people who are injured, sick, or even, let's just say, stressed out?
Well, it really hit me about 5 years ago when I was giving I've been all over the world lecturing on IV vitamin C. So I was in Tokyo, and the Japanese people are a rather sedate culture, very proper, and I was giving my third lecture on vitamin C of the day, and it was to a group of dentists and doctors, a small group, and I could tell from the pre-presentation before mine that these doctors already knew about vitamin C. So I asked my translator if I could just throw away my notes and just talk from my heart. And I had just read Erwin Stone's wonderful book, The Healing Factor, and what he basically points out is that vitamin C has been an intrinsic part of the success of the evolution of life. Without vitamin C, life could not have evolved as it has on this planet. And when any creature is injured, stressed, infected, any kind of challenge, we will begin to make more vitamin C in an adaptive mode. And unfortunately, we humans, somehow in the evolutionary process, the gene that makes the enzyme that converts glucose into vitamin C mutated. And we still have the gene, but we cannot make the enzyme. And so consequently, we have to take our vitamin C from the outside, either by mouth, through food or supplement. And what the big discovery was that Dr. Reardon, my mentor, made was that, he didn't make it, but a number of doctors found that giving IV vitamin C intravenously correlated more with some of the really best cases of the animal kingdom being able to make their own vitamin C at very high levels and thereby adapt more effectively to whatever was challenging them at that time.
So again, just to be perfectly clear, when an animal is not feeling well, it is built into their biology that they actually crank up the manufacturing of vitamin C. If it's just, say, 3,000 or 5,000 or 7,000 milligrams, let's say, of vitamin C that they're doing all the time and feeling happy, I mean, it could go up to 10, 15, 20,000 milligrams. Is that a clear way of saying it? And that what you're saying is for people, we need to, on an intellectual level, hey, I'm going through a lot more stress right now for the next week or two or month or whatever it is, and I need to crank up my vitamin C to help protect myself. I mean, that's what we need to try to understand here, correct?
Exactly right. The human being, the RDA for vitamin C is 1 milligram per kilogram per day, which is very, very tiny amounts. It's just enough to prevent scurvy, basically. And if you're under a lot of stress, it won't even prevent that. But a dog, for instance, can make 4 to 5 milligrams per kilogram per day. A spider monkey, now they can't, the primates and the guinea pigs cannot make their own vitamin C. But the spider monkey consumes the equivalent of 100 milligrams per kilogram per day, whereas a goat can make, if it's stressed, can make as much as 10,000 milligrams per kilogram per day. So it can go up in different amounts in different species. But humans, the important point here is that humans, we've completely lost the ability to make our own vitamin C. We must get it from the outside somehow.
I know you have a lot of experience administering vitamin C to tens of thousands of people. Do you know of any other molecule that has more research than vitamin C? Because a lot of people listening to this program, and I'm not putting it down, and I'm not being disrespectful, but they might be listening to this saying, come on, guys. Aren't we talking a little too much about vitamin C? I think quite the opposite. A lot of people are disconnected to how incredible C is and how much research is really out there about this nutrient.
Vitamin C is the most researched molecule in the history of science. Unfortunately, it's the most misunderstood molecule because most of the recent research in the last 10, 20 years has been horribly underdosed. The conservative nature of most doctors, based upon the fact that pharmaceuticals have a very narrow therapeutic window, has prevented them from utilizing vitamin C at the dosages that are needed to provide the adaptive powers that we've just been alluding to in our conversation. And so consequently, when you hear that vitamin C does not help the common cold, that's because they gave a measly dose. Maybe they gave 500 milligrams a day or even 1,000 milligrams a day. And we know from the research of Dr. Cathcart that certain illnesses such as mono can require as much as 100,000 milligrams of vitamin C per day orally, which people can take when they're sick. When they're sick, they can consume large amounts of vitamin C without getting diarrhea. because the body at that point has a tremendous oxidative stress load. And so the gut will, in a sense, gear up, and it will be able to uptake a much higher amount without causing the diarrhea. So we now know that there's many different clinical circumstances that exist for which different dosages are required. And this mismanagement of dose in terms of vitamin C has led to all the confusion as to the effectiveness of vitamin C in various conditions.
And of course, we've done many programs in the past. Maybe a lot of people listening to this program haven't heard them. They're in the Natural News Inner Circle. We've had friends of yours on, Dr. Andrew Saul, and people like this talking about the value of vitamin C. But this research is decades and decades ago. We see things like Dr. Klenner, who was out there in the 40s and the 50s, actually healing polio with vitamin C. Most people are like, what? What are you talking about?
That's exactly right. Klenner was able to, and he presented his data at an American Medical Association meeting. He published it. He had 60 cases of polio that was cured with high-dose vitamin C. But because at that point the polio vaccine was coming into vogue, people really want, in a sense, a simpler way of doing things. They kind of want the magic bullet. And vitamin C, in a sense, is and it isn't. It takes time and it takes clinical expertise to put together IV vitamin C, or to find the right dose, or to find the right mode of administration of vitamin C to fit that person's disease, their lifestyle. All these things have a clinical component that requires a management process, and it's a little bit more cumbersome than just poking kids with a needle or giving them some sort of vaccination, which we feel like is the magic bullet. But I think in the long run, we're going to find out that if we can do these things orthomolecularly, in other words, using the right molecule at the right dose for the right condition at the right time, we can restore the incredible healing capacity of humans that right now is under duress. We have many diseases, degenerative diseases, chronic illnesses that are not only burdening the U.S. healthcare system, but all around the world. We have a diabetes, an obesity, a cancer, a heart. We've got so many epidemics right now that we can't count them. And so we need to find ways to help people restore their own endogenous capability of adapting to these huge challenges that face us in our modern times.
I'm really looking forward to devoting more of this program to how IV vitamin C actually is more potent than oral vitamin C. I'd like you to explain that. We're going to be definitely talking to those people who are concerned about everything from the common cold, and also, of course, those people out there who are dealing with the experience of cancer. But I was thinking about you the other day, Dr. Hunninghake, on Fox News just recently. I just envisioned you sitting next to these television medical doctors. And, they also have medical practices, in all fairness. But they were up there as the medical experts for Fox News. And going back to what you were saying before about how vitamin C is so well researched, so effective, and yet when they do these studies or things and they say, well, vitamin C doesn't really work, maybe they did 500 or 1,000 milligrams and they say, oh, vitamins don't work. They were still pushing the agenda, and I'm sure you've heard something like this already that's come up in the news lately, where they are pushing the idea that vitamins and minerals don't work for heart disease and cancer. It's like the latest, greatest thing. They're now telling everybody it's a waste of time. Your comments, please.
Well, most of what they're doing, most of the vitamins, the way they have been studied has been inappropriate for how vitamins work. Again, the drug metaphor and the double-blind placebo-controlled trial is kind of the paradigm of the so-called evidence-based approach. And consequently, the best way I explain it to patients is that if it's really, you have to think that nutrients work as a team. And as much as we're going to talk about how great vitamin C is, even it by itself is not the whole answer. And so whenever these individual vitamins have been studied using the double-blind placebo-controlled trial, randomized trial, it's really just taking one vitamin and pitting it against one disease. So let's, use an analogy. The Kansas City Chiefs just played the Denver Broncos last night. Well, let's just send the Kansas City Chiefs quarterback out against the other team, and let's just see how well he does by himself without regard to the rest of the team. It's ridiculous. You have to look at nutrients as part of a whole team, and that's why Dr. Reardon's insight into doing nutrient testing on a comprehensive basis with chronically ill patients is so important. Of course, we're going to give them vitamin C, but we do not ignore the rest of the team. Vitamin C, even by itself, would not be so effective if we hadn't began to work on the other weak links in the patient's nutritional chain. And so I think a lot of these studies where they say, such and such vitamin doesn't work for such and such disease, I think it's a misconstrued understanding of how nutritional therapies have to function in order to help the body recover from any threat or illness.
But of course, there was also one other thing that really made me think about you. Right at the end, they went beyond just saying, well, hey, these vitamins and minerals, they don't really work. They actually flat out said specifically about vitamin C, watch out, causes kidney stones. And I said, that's when I wanted you to be sitting right there and give your answer, because I think you have a little bit of experience giving lots of vitamin C to lots of people over years. Please respond to that comment.
Well, I've been at the Riordan Clinic for 25 years, and my estimate, which I probably need to upgrade, is that I've overseen 60,000 IV vitamin Cs. And we give on the average of 25,000 to 50,000 milligrams of vitamin C intravenously for each one of those vitamin Cs. My own wife, I've given probably 400 of these large IV vitamin Cs to in the care of her breast cancer, and she's now a 12-year survivor. But in those 25 years, 60,000 IVCs, I can remember one person, who developed a kidney stone, which that stone may have even been there before we ever gave them the vitamin C. So I kind of tell people if it were really true that vitamin C caused kidney stones, the Riordan Clinic would be the kidney stone capital of the world, but we're not.
In all honesty, I know people are going to say, oh, Jonathan, you're speculating. But I would have loved to have sit on that panel as well and just turn to that doctor and say respectfully, have you ever given high-dose vitamin C to your patients? And please tell me what your experience is. And, he would probably stumble and say, well, no, of course not. I don't do that because I read it somewhere that it causes kidney stones. Again, I know it's speculation, but I think that's probably a fairly good educated guess. That would be one of his answers.
And there are published studies in the urologic journal. I think there was one where they looked at about 3,000 people who were taking various doses of oral vitamin C, and they found that their incidence of kidney stones were less than in the average population. So not only does it not cause it, but it may actually help prevent it.
Yeah, I just wish they could read better. So anyway, moving on, Dr. Hunninghake, why is IV vitamin C so much more potent than oral vitamin C? Is that an accurate way of putting it?
Yes, it is. Probably the easiest way to kind of explain that over the airways here is that we always measure a vitamin C level on just any person walking in the door. And the average person's blood level is 1 milligram per deciliter. And you can really gear up your oral intake of vitamin C. And as a little research project a couple years ago, I, over a period of time, boosted my oral intake up to about 34,000 milligrams a day. I was using some liposomal C and various vitamin C powders and whatnot, so I was able to get up to a pretty high dose without having diarrhea. And my blood level at the peak of doing this for 12 days was only around 5.3 milligrams per deciliter. But if we give a 15,000 milligram vitamin C infusion over about 30 to 40 minutes, we can hit a blood level of about 125 milligrams per deciliter. And if we go up to 25 grams, we're going to probably get over 200 milligrams per deciliter. And then if we hit our target dose of 50 grams per day for a cancer patient, we can typically get them into 300 to 400 milligrams per deciliter per day. So what we're doing using the concept of quantum physics, is we're moving into a new quantum of dosage that cannot be achieved orally. And at these higher dosages, there's something called redox cycling that occurs that takes vitamin C from simply being an antioxidant into acting as a pro-oxidant. And this is why I do a lecture called the bioxidant paradox. How can an antioxidant function as a pro-oxidant at the same time? And this just gives you a hint of the incredible diversity and power of vitamin C at high dosages.
Well, hopefully not to confuse matters, but that's another interesting thing that has been heard quite a bit in the natural health world. It's even been mentioned on my show. I'd love for you to clarify this one point just a little bit more. When you say that it flips from an antioxidant to a pro-oxidant, it's almost as if that could be misinterpreted as that's not a good thing. Why is that good?
Well, it does not flip. It assumes the role of both. So that's really hard for people to get their minds around, other than the fact that our whole body is all about redox cycling, in the sense that when we eat food, we're taking antioxidants, and the body uses the antioxidants to help control the process of oxidation. Oxygen is an oxidant, and that's how we burn calories in order to create energy. But that process of creating energy creates free radicals that have to be shepherded through the oxidative process. And so the antioxidants kind of help protect the cells from this fire of life that is so important. And pro-oxidants are also used in the immune system. The white blood cells contain lysosomes, and these lysosomes contain hydrogen peroxide. And so when we develop an infection and the white blood cells attack the bacteria or whatever it is, it uses hydrogen peroxide, a pro-oxidant, as part of its defensive strategy. And so there's this interesting kind of two modes of action, antioxidants and oxidation, that are essential to life. And that's why vitamin C has played such a central role in the evolution of life on this planet.
Dr. Hunninghake, does vitamin C actually help prevent and treat the common cold? And if so, which I imagine you would say it does, how does this happen?
Well, vitamin C strengthens the immune response. It basically enhances endorphins within the body, so your own sense of well-being and strength in general is enhanced by vitamin C. And as I mentioned, if you get high enough dosages of it, it can act as a pro-oxidant, so it can enhance the white blood cells, which are your key warriors in the defense against viral infection. They will uptake vitamin C more actively than any other cell in the body. So the white blood cells really do concentrate vitamin C. So when you take in more vitamin C, you're enhancing the effectiveness of the white blood cell to perform what's called phagocytosis, or to gobble up the infecting agents. And we found that, for instance, white sugar will deteriorate that ability of the white blood cells. So vitamin C, it's kind of interesting that vitamin C itself is made from glucose, which is a sugar. So think of it as an activated sugar that helps the body deal with threats such as infections. And so Dr. Cathcart, Bob Cathcart, was the one that was able to show that when people started to get symptoms of the cold, that they would benefit from greatly increasing their intake of vitamin C. I personally have found that everyone can determine what their body's need for vitamin C is by doing what's called bowel tolerance dosing, where you find a form of vitamin C orally that you're comfortable with, and you gradually increase your dose until you reach the point to where you start to feel some discomfort in your bowels, and then you drop back 10% or to a point of comfort, and that then will be your dose. Now that varies all over the place. I've had a nurse that could not take more than 500 milligrams a day. Well, I personally need about 12,000 milligrams a day and have felt wonderfully healthy at that dose. So I think each person has to individualize their need for vitamin C in the prevention of colds. And then once you get a cold, of course, you need to take quite a bit more in order to help the body deal with the enhanced oxidation that the infection causes.
And of course, people out there are very concerned about the source of vitamin C. Yes, we have to be concerned if it's coming from China, Is it genetically modified corn source? Obviously, there must be some concern, and I'm sure you're being very careful of the purity of what you give your patients.
We use a non-corn source of IV vitamin C. We're using liposomal vitamin C. We've got about 7 different types of vitamin C that we work with in terms of helping patients achieve an optimal use of vitamin C.
And isn't it true that the form of vitamin C that's given in an IV is very different than the oral or liposomal, that people need to understand it's a very specific type that's given for IV treatments?
Well, here's the thing, you can't give ascorbic acid IV because the pH would be too harsh and it would burn. And so the ascorbic acid has to be alkalinized either with sodium hydroxide or sodium bicarb. And so when you alkalinize the ascorbic acid to a pH of 7, which is a neutral pH, you have added additional sodium ions, but there's no chloride. A lot of the negative effects of salt, sodium chloride, is the chloride, not the sodium. So, but still we have to be aware when we're giving large amounts of IV vitamin C, which is sodium ascorbate, we have to be aware that the sodium load could be an issue for someone if they have renal failure, or if they have congestive heart failure, if they have some kind of fluid overload syndrome. And so this is why IV vitamin C is still a medically regulated process that has to be done in the hands of someone who understands it well.
Yeah, and you just almost took all the words right out of my mouth, Dr. Hunninghake. People listening to this program should never feel overwhelmed. We're trying to give some good information here, have people just as a starting point hear something and then go investigate on their own. But just to be perfectly clear, you have a Reardon protocol that you follow that you actually make available to physicians. Now, as we move, Dr. Hunninghake, into talking about how IV vitamin C actually helps cancer patients, I'd like you to speak to that, and I'm sure you're going to be talking about the protocol that is available for people to give to their physician if they're open enough to do something like this. So please speak to all that.
Yes, you can go to RiordanClinic.org, and you can click on research, and you can click on there's one of the tabs is the protocol, and there's a place there where you can click, and it will download to your computer the PDF file, which you can print out and take into your doctor. It is the 4th rendition of the Reardon IVC protocol, which has been in existence now since 1990. So we're approaching our 25th year of utilizing the protocol. The main emphasis of the protocol is safety. So we do advise some specialized testing to make sure that you do not have a G6PD deficiency, that you've had your renal function assessed. It needs to be given to you under the care of a knowledgeable physician. We list all of the mechanisms whereby we have thus far found that it works. So there shouldn't be any question on the part of any physician who takes the time to read the protocol that it doesn't have a scientific background to it. And it can be administered at home by a licensed nurse or by someone who can provide that kind of care, but we are very cautious about that. But it is, once you get all the basics in place, it is probably about the safest medical procedure you can imagine once all the possible complications have been ruled out and the patient has been assessed appropriately and dosed appropriately. And you'll find out in the protocol that there is a 15, 25, and 50-gram 3-day structure to the ascending dose. And after each of those dosage, we do a post-IVC saturation level. We can then plot a trend line, and find out what dose is needed to give people a blood level of around 350 to 400, which was established in the 1990s when Dr. Reardon looked at over 46 different cell types in culture and found out that somewhere around 350 to 400, all types of cancer cells would respond to this dose of medication, of IV vitamin C, And so even having said that, though, remember that's in cell culture. And so we're not dealing with a cell culture. We're dealing with a live human being who has various stages of cancer and various circumstances, that all that needs to be taken into consideration. And that's why we now refer to the Riordan IVC protocol as an adjunctive therapy. You could almost refer to it as a lifestyle type therapy that will help enhance the patient's response to conventional therapies, or if they're not doing conventional therapies, it will help their indigenous response to the illness. And then you can also use a number of other alternative therapies along with it, and it is completely compatible.
Okay, so just to clarify things, Dr. Hunninghake, when cancer patients, and they are able to come to the Riordan Clinic to actually be treated this way, sort of a few days, take us through the process of what you do. Obviously, you're evaluating this G6PD. It's an enzyme deficiency, right? I'd like you to talk about that as well. Is there a danger for people orally taking vitamin C, that if they have this deficiency, that's a problem, or does it pertain just to the IV? And then just sort of take us through what, typically a cancer patient might experience if they went to the Riordan Clinic.
Okay, let's just start with G6PD, and then we'll go to the whole step-by-step of what a cancer patient experiences at the Riordan Clinic. The G6PD is a very, very rare deficiency that occurs mostly in people of Mediterranean descent. And all it means is that you lack an enzyme that would otherwise help you deal with free radical stress that would break apart the membranes of the red blood cells. In other words, lysis, RBC lysis, or where the red blood cells break apart. So it has occurred very rarely in people taking IV vitamin C, which is really just highlights exactly what vitamin C does at high dosages. It creates a pro-oxidant effect. It creates hydrogen peroxide. Dr. Mark Levine at the National Institute of Health has published 2 wonderful papers that show he actually did a kind of dialysis of the animal model extracellular fluid, where he demonstrated that the hydroxyl radical is formed in the presence of high-dose vitamin C, which is great. That's part of the mechanism for how IV vitamin C has a selective cytotoxic effect against tumor cells. But if you've got a G6PD deficiency and your red blood cell membranes are unstable, then that hydroxyl radical could cause red blood cell lysis, or breaking apart, which would clog your kidneys and cause some serious problems. So we do a G6PD level on all of our patients. And over the years, we've only found about 4 people who are kind of borderline. We've never had an incident in the 60 to 70,000 IVCs that we've given since I've been there. But part of the reason we haven't is because we screen for it, and we do recommend that as part of the Reardon protocol.
Is it something to be concerned with, though, for people who say, take 20, 30, maybe even 40, 50,000 milligrams of oral vitamin C? Is that a concern?
No, it isn't, because as I mentioned earlier, I took 32,000 orally, and all I could get my blood level up to was 5.3. We're shooting for 400 or 500 milligrams per deciliter with our IV vitamin C, and it's only at these quantum levels of plasma C that we see this significant pro-oxidant effect of vitamin C, the hydroxyl formation, hydroxyl radical formation. So normally people just taking vitamin C, even large amounts orally, they would not need to be concerned about that.
And so you also mentioned how IV vitamin C is not the magic bullet for cancer patients. Please don't get distracted by that idea that this program is focusing on IV vitamin C. For cancer patients, it isn't just a magic bullet. What else do you do with cancer patients? Can you describe that a little bit?
Yeah, that's okay. That's part 2 of that question. So we have patients come in. Of course, they're at all stages. Unfortunately, I wish people would call us at stage 1 and stage 2. Oftentimes, the people who call us are the people who they're a stage 3 or stage 4, and they've already been on massive chemotherapy. They've been on 2 or 3 different types of chemotherapy. Their system is all beat up, and then they come in at what I call the 11th hour looking for the magic cure. And so really the best time to start vitamin C is before you start chemotherapy, because we have research that shows it's a wonderful adjunct that will not interfere with vitamin C. Unfortunately, our our oncologic colleagues do not get that point. They basically say, well, vitamin C is an antioxidant, so it's going to neutralize the effectiveness of the chemotherapy or radiation. And we had my wife, when she went through her radiation therapy for breast cancer, we had the radiation oncologist come out and meet with our research staff, and it satisfied him that not only do you get the protective antioxidant effects for your healthy cells, because your healthy cells also create an enzyme called catalase, which will neutralize the hydroxyl radical. But your cancer cells do not make catalase. So the hydroxyl radical, in conjunction with chemotherapy and radiation therapy, can help make conventional therapy more effective. And so part of our goal here is not to create another polarity of us against them, but we want every cancer patient to have the best possible outcome for whatever they decide to do. It's a very highly personal, individualized choice as to what people decide to do in the care for their cancer. And so we are not going to put them in an either-or decision-making spot. We want them to understand that the IV vitamin C can be a wonderful adjunctive care strategy along with whatever your regular doctor is deciding to have you do, your oncologist is deciding to have you do. But then if you decide not to do chemotherapy or radiation, you can still make very good use of IV vitamin C. And this is where the rest of our program comes into play, because we actually test every nutrient that's possible. We can test all the B vitamins, all the antioxidants, all the CoQ10, the amino acids, the fatty acids. Our lab specializes in testing all the micronutrients that are necessary for your cells to be healthy. And just recently we added Dr. Mike Bauerschmidt, who is a doctor of environmental medicine, and our next big thrust is to work on detoxification strategies for the cancer patient so that as they are going through therapy, they can more effectively dump all the debris any kind of chemotherapy gives rise to that will very often overload the detox system. So really, the three components here are making sure you have adequate good nutrients to feed your cells, making sure the detox pathways of the cells are working optimally, and then to use vitamin C as that kind of superlative adaptogen that it is, that intrinsic adaptogen that has helped life evolve on this planet and to deal with the exigencies of existence in this world.
This next question I'm going to ask you is way beyond the scope of this program, but just for a couple minutes, Dr. Hunninghake, you just talked about how vitamin C is an adaptogenic type molecule. It can help us in so many ways to create a much healthier environment, basically making it very unfriendly for cancer cells to thrive. Speak to how IV vitamin C or any other dose of any other form of vitamin C can actually help those people that have heavy metal toxicity, they have radiation exposure, whether it's from medical technology or actually being concerned about what's coming over from Fukushima. I mean, there's all of this that vitamin C can just sort of be a buffer for us. Isn't that true?
Yeah, I mean, in my presentations that I give all around the world on vitamin C, I basically say when you look at cancer, it represents a long-term injury at some focal point in the body. Cigarette smoking obviously causing injury and accumulation of carcinogens and damage to the lung tissue. And over time, the growing inflammation creates a localized environment that is hostile to life. And really what many authors have said is that cancer cells are really multicellular cells that have regressed in an effort to survive in a localized environment of hostility. They begin to function more like single-cell organisms that are just trying to survive on their own. They don't care about the rest of the organism. They're just trying to survive in this localized area of inflammation and injury, whether it be radiation, chemical, stress. All of these things bring about chronic inflammation. And at its very essence, high-dose vitamin C is anti-inflammatory. Doesn't mean that inflammation itself is bad. It's just that when you carry it to its extreme, most of the modern diseases that we doctors treat in patients, they're all itis diseases. You've got dermatitis and arthritis and arteritis. All the various organs of the body, when they become inflamed out of proportion, that's when things start to go awry. And what vitamin C does is that it helps the body eliminate the cause of the exaggerated inflammatory response, and thereby helps promote more of a resolution of this, healing response gone awry.
And I think it's just so important that we're bringing in this idea of putting more vitamin C into the body. But like you said, it's a multifaceted approach. For women out there who are chronically stressed and they're worried about breast cancer and uterine cancer, right, and cervical cancer, all of these things, the ovarian cancer, let's not put computer devices on our lap. Let's not radiate our body unnecessarily. Let's not eat all of these toxic foods. Let's try to get rid of some of the heavy metals or the mercury that might be sitting in the dental amalgams in our mouth, the mercury-based fillings. I mean, it's about really appreciating our body as the terrain that it is. Stop the assaults and try to build in these nutrients that really help protect us. I'm sure you would agree.
Dr. Sidney Baker, who was a great guy, I think he's still alive, he wrote a book called Detoxification and Healing, and he had this thing called tack theory, that if you've sat on 2 tacks and your bottom is hurting really bad, taking an aspirin or taking a pain pill is not it'll relieve some of the pain, and if you've sat on 2 tacks, taking IV vitamin C, that'll help with some healing, but you still want to take out the tacks. So detoxification and prevention of exposure, reducing exposure to toxins, these are all part of the self-care paradigm that we mentioned at the beginning of the show.
And just to close out the program, Dr. Hunninghake, I appreciate your time so much. Just talk about the nuances, if you will, the different kinds of vitamin C that are out there. You've mentioned liposomal, you've mentioned the powdered vitamin Cs. We've talked quite a bit about the IVs. How do we just make it really simple and clear in our minds for those out there who really want to just get started taking vitamin C?
Well, I think if you can find a buffered form of vitamin C, that's not a bad place to begin. I like for people to include the bioflavonoids with it if you can. That'll make it more of a vitamin C complex. Normally vitamin C, obviously the best place to get vitamin C is from your food. So eating whole foods, colorful, nutritious, organic whole foods is probably your best source of natural vitamin C. But if in the environment that we're in, you can then supplement that with either you can do ascorbic acid with your meals, and it'll actually help your digestion, or you can do buffered vitamin C in between meals for those people that have delicate digestive systems, because we so many people, their digestive systems are so out of whack that very much vitamin C will kind of cause a lot of rumblings and gas and whatnot. So you have to be a little bit careful and start low in that case and start to work on cleaning up your gut. There are vitamin C powders that are buffered that are quite good. Ester C can work well for a number of people. The liposomal vitamin C is something new that is a phosphatidylcholine kind of bubbles within bubbles. They're nanoparticles, and then the vitamin C is between the bubbles. They actually cross the cell membrane of your mouth and esophagus and upper stomach, so you don't really have to absorb the vitamin C through the gastrointestinal system. So for people that have really sensitive digestive systems, I would strongly recommend the liposomal vitamin C. Dr. Levy, who's one of the foremost proponents of vitamin C in the world, feels like it crosses the cell membrane more readily than regular vitamin C, which has to be transported into the cell. And so that's a good choice. It's expensive, but it's well worth the cost. And then IV vitamin C is where we can hit those quantum levels of vitamin C that are necessary to really help people in dire circumstances to overcome conditions such as cancer, heart disease, depression, chronic fatigue, chronic viral infections, any kind of chronic illness that requires an adaptogenic response. You should at least look into doing IV vitamin C once a week or periodically in terms of getting that really nice push of high-dose C into your system.
Dr. Hunninghake, I want to thank you so much for your time, and I want to thank our listeners for joining us today. For more information about Dr. Ronald Hunninghake, visit RiordanClinic.org.
And Jonathan, thank you for the service you're doing to get this word out. It's fantastic, so keep up the good work.
I'm your host, Jonathan Landsman. I hope you enjoyed this program. Thank you for your support. Talk to you soon. Take care.